Welcome to the deep dive. You've shared some really interesting material with us. Looks like you want to get a solid handle on chronic stress,
Yeah,
but, without feeling like you're wading through a textbook.
exactly.
So think of this as your personal shortcut to understanding what really matters here.
Absolutely. You've given us a great collection of articles, research,
Yeah.
looking at chronic stress from, well, how it works in the body
Right.
to how it actually shows up in our lives, and crucially, what we can maybe do about it based on, solid evidence.
Our goal here is simple. Pull out those crucial insights, connect the dots in a way that hopefully makes sense,
Mhm.
and leave you feeling genuinely informed about chronic stress, its impact, and importantly, the strategies that actually work.
Let's do it.
Okay, let's unpack this.
Mm.
At its core, what is stress, fundamentally?
Well, simply put, stress is how your mind and body react together. They react to any kind of demand or challenge. We call these stressors.
Right.
And this reaction involves a whole series of biological changes, including the release of certain hormones, stress hormones.
Okay.
What's really key to understand first, I think, is the difference between what some people call good stress and bad stress.
Good stress. Is there such a thing?
Yeah, there is. Good stress, or eustress, is that short-term motivating kind. Think about the energy you feel before, say, giving a presentation you feel prepared for.
Okay, yeah. Like nerves, but productive nerve.
Exactly. It can actually
It-
drive you, give you focus.
Right, that focus, game-on feeling. But then there's the other kind, the one we usually worry about.
Precisely. That's distress or bad stress. This is what happens when we feel like we're not in control.
Lack of control, yeah.
When stressors are ongoing, irritating, just plain draining, mentally and physically. This is the type that really takes a toll over time.
Okay.
And actually, to get a good grip on chronic stress, it's helpful to first understand its shorter-term cousin, acute stress.
Okay, so let's differentiate. Acute versus chronic. What's the deal with acute stress?
Acute stress is your body's immediate, instant response to a sudden trigger.
Like a car cutting you off.
Perfect example. Or maybe a heated argument. This kicks in what's often called the fight or flight response.
The classic fight or flight.
Yep. And this involves your sympathetic nervous system. Think of it as the body's accelerator pedal.
Okay.
And a really key system we call the hypothalamic pituitary adrenal axis, the HPA axis.
The HPA axis.
Mm.
That sounds important. Definitely feels like something we need to circle back to.
Oh, absolutely. It's central.
But for now, sticking with acute stress, what actually happens in our body during that fight or flight moment?
It's like a rapid mobilization of all your resources. Your mind becomes super alert, almost hyper-focused. Your muscles tense up, ready for action. Your heart beats faster. You breathe more quickly. Your blood pressure shoots up.
You might start sweating.
Yep, sweating. Your pupils dilate to let in more light, and you get this quick surge of hormones, adrenaline, and noradrenaline first.
The immediate rush.
Exactly, the immediate rush. And then, a bit later, cortisol comes into play. These are all protective mechanisms, really, designed to help you deal with an immediate threat.
That makes total sense.
Huh.
All systems go for a quick reaction, get out of danger. So chronic stress is basically just that, but dragged out.
Pretty much. Chronic stress is stress that goes on for a long time. We're talking weeks, months, or even years. It's like being stuck in that state of constant alert.
Stuck on.
Right, even when there isn't a clear and present danger right in front of you. And the sustained activation leads to what scientists call increased allostatic load.
Allostatic load. Explain that a bit.
Think of it as the cumulative wear and tear on your body. It's a price your body pays for constantly trying to adapt to being under stress.
Okay, wear and tear. Got it. And what kinds of situations typically lead to this kind of prolonged chronic stress?
The causes are often persistent, and they can be quite varied, really. Things like ongoing financial difficulties, money worries.
Big one for many people?
Huge. Continuous interpersonal conflicts, like serious problems in a marriage or ongoing family feuds. Job dissatisfaction, hating your work.
Or job insecurity.
Or insecurity, yes.
Yeah.
Dealing with chronic illnesses, either your own or maybe a loved one's. Long-term caregiving responsibilities can be incredibly stressful.
Absolutely.
And sometimes it's even just constantly perceiving everyday demands as overwhelming threats. And sadly, difficult experiences early in life, trauma, can also make someone more susceptible to developing chronic stress responses later on.
So it's like the body's alarm system just gets jammed in the on position.
Precisely. The body stays in this continuous state of high alert. And that central stress response system we mentioned, the HPA axis, it really
Those
struggles.
struggles, how?
It struggles to return to its normal baseline, its resting state. This means that levels of stress hormones, particularly cortisol, stay elevated for way too long. It's really a maladaptive state,
Maladaptive meaning.
meaning it's not helpful anymore. Your body is acting as if there's an immediate danger constantly, even when there isn't one. The response has outlived its usefulness.
You mentioned some specific patterns of chronic stress earlier. Can you give some examples?
Yeah, a couple come to mind. One pattern is called episodic acute stress. You see this sometimes in people who seem to live really chaotic lives.
Always rushing.
Always rushing, always late, feeling overwhelmed, constantly irritable. Maybe their relationships are strained. It's like they experience these frequent bursts of acute stress, but never really get enough time to recover in between.
Okay, so one crisis after another.
Exactly. And then there's burnout. That's a specific type often linked to work.
We hear a lot about burnout these days.
We do, and its key features are things like deep emotional exhaustion, feelings of cynicism or detachment from your work, and this nagging sense of not being effective or accomplishing anything meaningful in your role.
Okay, so if we were to summarize the main differences between acute and chronic stress,
Yeah.
it really boils down to duration, obviously.
Duration is key, yes.
How the body responds physiologically, like, is it a quick burst that resets, or is it this sustained, maybe even broken response?
Exactly. Regulated versus dysregulated is a good way to think about it.
And then the impact on our health.
Mm.
Acute is generally temporary, maybe even helpful sometimes.
Right. Adaptive in the short term.
Whereas chronic is where the long-term damage can really happen.
That sums it up really well. And one other important point, even if you're dealing with frequent acute stressors, one thing after another.
Like that episodic acute stress you mentioned.
Exactly. If you don't have enough recovery time between them, or if they're all happening within an overall stressful context, like a demanding job and family issues,
Right.
their combined effect can start to look and feel a lot like the impact of chronic stress. Someone constantly putting out small fires might end up in a similar physiological state to someone facing one huge long-term blaze.
Okay, that makes sense. This definitely brings us back to that HPA axis you mentioned earlier. Sounds like it's the star player in this whole story.
It absolutely is. The hypothalamic pituitary adrenal axis is really the body's central command center for managing stress. It's a key neuroendocrine system.
Neuroendocrine meaning brain and hormones.
Exactly. It involves both the nervous system and hormones. Think of it as a communication network, a hotline between specific parts of your brain and your adrenal glands.
Adrenal glands, those sit on the kidneys, right?
That's right, on top of the kidneys.
Right.
The system has a few main parts. The hypothalamus in the brain, specifically an area called the paraventricular nucleus, or PVN.
Okay.
The pituitary gland, also in the brain, just below the hypothalamus. And then the adrenal glands themselves.
Okay, hypothalamus, pituitary, adrenals, HPA. Got it. How do they talk to each other when we're stressed?
It's a cascade, really.
Yeah.
When your brain perceives something as stressful, the hypothalamus, the PVN part, releases a hormone called corticotropin-releasing hormone, or CRH.
CRH.
And also another one called arginine vasopressin, or AVP, which kind of boosts CRH's signal.
Right.
CRH then travels just a short distance to the anterior part of the pituitary gland. This signals the pituitary to release another hormone into the bloodstream, adrenocorticotropic hormone, or ACTH.
ACTH. So CRH triggers ACTH.
Yep, and then ACTH travels through your bloodstream until it reaches the adrenal glands, specifically the outer layer called the adrenal cortex.
Okay.
And ACTH reaching the adrenal cortex is the signal for it to produce and release glucocorticoids. In humans, the main glucocorticoid is cortisol.
Cortisol. That's the one everyone talks about.
That's the main stress hormone, yes. So it's this chain reaction. CRH leads to ACTH leads to cortisol.
Okay, this hormonal chain reaction gets triggered, but how does it normally switch off? It can't just stay activated all the time, right?
Yeah.
That sounds exhausting.
Exactly. It's designed to switch off. There are two main ways the HPA axis is regulated under normal, non-chronic stress circumstances. First, there's our natural daily rhythm.
Circadian rhythm.
Precisely, the circadian rhythm. Cortisol levels naturally go up and down throughout the day. They typically peak in the morning.
To help you wake up.
Exactly. Helps you feel awake, alert, energized for the day. Then they gradually decline throughout the day, reaching their lowest point usually late at night, which helps you wind down and sleep.
Okay.
And it's interesting, actually, when this normal daily up and down pattern gets flattened out, it's been linked to things like chronic fatigue and insomnia.
So that daily rhythm is really important. What's the second way it's regulated?
The second crucial mechanism is called negative feedback. It's like a built-in brake system.
A brake system. Okay. How does that work?
Well, when cortisol levels in the blood rise high enough, the cortisol itself acts as a signal. It feeds back to the brain, specifically to the hypothalamus and the pituitary gland, and basically tells them, okay, we've got enough cortisol now, you can ease up. It inhibits the release of more CRH and more ACTH.
Ah, so the end product shuts down the production line.
Exactly. It's essential for limiting how long the stress response lasts and how intense it gets, and for bringing the whole system back to its baseline once the stressor is gone.
How does cortisol send that stop signal?
It does this by binding to specific receptors. Think of them like docking stations in various brain regions. Key areas include the hippocampus, which is involved in memory and learning, the prefrontal cortex, important for decision-making, and even the PVN in the hypothalamus itself. When cortisol docks onto these receptors, it triggers the turn-off signal.
So it's like a thermostat. It senses when the cortisol level is high enough and then turns down the CRH and ACTH production.
That's a fantastic analogy, yes. Now, when we experience acute stress, this HPA axis gets activated pretty quickly, starting that hormonal cascade, CRH to ACTH to cortisol.
Right.
It's worth noting, though, that the cortisol response takes a bit longer to peak compared to that immediate adrenaline rush. We're talking minutes to maybe an hour or so rather than seconds.
Okay.
And the cortisol that's released during acute stress actually has some helpful effects in the short term.
Like what?
Well, it helps mobilize energy reserves by increasing blood sugar, giving your muscles fuel. It helps modulate inflammation, preventing an over-the-top immune reaction. And it can even help consolidate memories of the stressful event.
So you remember not to do that again?
Potentially, yes. Could be useful for avoiding similar dangers in the future. Then, as we discussed, that negative feedback mechanism kicks in, cortisol levels drop, and everything returns to normal.
Okay, that's the ideal scenario. But what happens when stress becomes chronic? How does this normally well-oiled machine, this HPA axis, get thrown off balance?
Yeah, this is where things go wrong. Chronic stress leads to a persistent disruption, a dysregulation in how the HPA axis normally functions. This imbalance can show up in several ways.
Such as?
You might see consistently elevated baseline levels of cortisol throughout the day. Or the system might become hyperreactive, leading to an over-the-top, exaggerated cortisol response whenever a new stressor comes along.
Wow.
Or, in some cases, particularly after very prolonged or intense stress, the system might seem to become exhausted, leading to a blunted or lower than normal cortisol response. It's complex.
And that thermostat analogy, the negative feedback.
Yeah.
Does that stop working properly under chronic stress?
It certainly can. That's a key problem. The negative feedback mechanism can become much less effective.
Why? What happens?
Well, prolonged exposure to high levels of cortisol can actually damage the system. It can reduce the number or decrease the sensitivity of those cortisol receptors, the docking stations in those important brain areas like the hippocampus and prefrontal cortex.
So the stop signal doesn't get through as well.
Exactly. It makes it harder for cortisol to effectively signal back and tell the system to slow down production. This can create a kind of vicious cycle. High cortisol makes the brakes less effective, which leads to even more cortisol being released. And it gets worse. The ongoing inflammation that often accompanies chronic stress can also directly damage these receptors, further messing up the feedback process. So the body essentially loses some of its ability to properly turn down the cortisol tap.
So the body loses its ability to regulate cortisol levels properly. That sounds really problematic for overall health.
It is, absolutely. And chronic stress causes other changes in the brain itself. Prolonged exposure to high levels of stress hormones like cortisol has been shown to cause a shrinking or retraction of the connections between brain cells, these called dendrites.
Shrinking connections.
Yeah, particularly in areas like the hippocampus. It can also inhibit the growth of new brain cells, neurogenesis, in the hippocampus.
Yeah, the hippocampus is important for
Memory, learning, and also, critically, for regulating the HPA axis itself. So damage there can further weaken that negative feedback loop we just talked about.
another vicious cycle.
Exactly. Essentially, a brain under chronic stress can become less efficient at turning off the stress response. What's more, chronic stress seems to activate different brain circuits compared to acute stress, establishing these ingrained patterns of brain activity that become harder and harder to switch off even when the stressor is gone.
You also mentioned earlier how the body responds to repeated stress. Does it ever just, get used to it, build up a tolerance?
It's a complicated picture. Sometimes yes. When you're repeatedly exposed to the same type of stressor, what researchers call homotypic stress.
Homotypic, meaning same type.
Right. Your body can develop habituation. This means you see a smaller and smaller HPA response, less cortisol release over time with each exposure. Think of it like getting used to a repetitive, annoying sound. You eventually react less and less.
Okay, so the body learns it's not that big a threat.
Kind of, yeah. It's generally seen as an adaptive process, helping us conserve energy when faced with predictable, non-harmful things. However,
There's always a however.
always, if you've experienced significant stress in the past, it can sometimes lead to the opposite effect, something called facilitation or sensitization.
What's that?
That's where your HPA response to a new or different stressor is actually stronger or more exaggerated because of your previous stress exposure.
So past stress can make you more reactive to future stress.
It can, yes. Whether you habituate or become more sensitized depends on a lot of factors. The intensity of the stressor, how often it happens, how predictable it is, and even your individual genetic makeup and early life experiences play a role. So it's definitely not as simple as just getting tougher or getting used to it.
So it's not a simple case of just getting tougher over time.
Not at all. And it's really crucial to remember that cortisol isn't just about the acute stress response. It's involved in so many other vital everyday functions.
Like what else does cortisol do?
Well, it plays a critical role in metabolism, how our body uses carbohydrates, fats, and proteins for energy. It's essential for controlling inflammation throughout the body. It helps maintain healthy blood pressure and regulate blood sugar levels. It influences our sleep-wake cycle, that circadian rhythm we talked about. And it even contributes to cognitive functions like memory and concentration. It's a hormone we absolutely need to function properly day to day.
When it's chronically high, when that HPA axis is dysregulated, that's when the trouble really starts brewing, right?
Exactly. Prolonged exposure to elevated cortisol levels, what we call chronic hypercortisolism, has detrimental effects on pretty much every single system in the body.
Okay, let's break that down. What does it do to, say, the immune system?
For your immune system, it's a double-edged sword. Initially, it can suppress immune function, making you more susceptible to infections, colds, flu, etc. But paradoxically, chronic dysregulation can also contribute to ongoing low-grade inflammation and potentially worsen or trigger autoimmune issues where the immune system attacks the body's own tissues.
Okay, what about metabolism? You mentioned energy use.
Yeah, metabolically, chronic high cortisol is bad news. It promotes weight gain, especially that dangerous visceral fat around the abdomen.
Belly fat.
Exactly. It can lead to insulin resistance, which significantly increases your risk of developing type 2 diabetes. And it can trigger cravings for unhealthy, high-calorie foods, comfort foods.
The stress-eating phenomenon.
Precisely.
And the heart. Cardiovascular system.
For the cardiovascular system, chronic high cortisol is a major contributor to high blood pressure or hypertension. It significantly increases your risk of developing heart disease, having a heart attack, and suffering a stroke over the long term.
What about the brain? You mentioned the hippocampus shrinking.
Yeah, in the brain, it can cause insomnia, make it harder to remember things and concentrate, that brain fog people talk about. It contributes to that hippocampal atrophy, yes. And critically, it increases the risk of developing clinical depression, various anxiety disorders, long-term cognitive decline, and potentially even dementia later in life.
Wow, even digestion.
Oh yes, the gut is very sensitive to stress. Chronic high cortisol can really disrupt the gastrointestinal system, leading to problems like indigestion, acid reflux, irritable bowel syndrome, IBS, constipation, diarrhea, basically messing with your gut function and microbiome. It's definitely far-reaching.
It really sounds like there's almost no part of the body that escapes the impact of chronic high cortisol.
That's largely true, unfortunately. It can also negatively affect the reproductive system, leading to dysfunction, irregular menstrual cycles in women, low libido in both sexes, and potentially contributing to fertility problems. It can impact your skin, yeah. Possibly accelerating signs of aging, triggering acne or eczema flare-ups, slowing down wound healing, and making you bruise more easily. And there are other potential links, too, to things like chronic fatigue syndrome, muscle weakness, thyroid problems, and even reduced bone density, increasing the risk of osteoporosis.
Okay, so this chronically high cortisol is clearly bad news. What keeps these levels so stubbornly high? It can't just be the ongoing stressful situations themselves, can it?
That's a great question. While persistent stressors, whether they're psychological, like worry, social, like conflict, or even physiological like chronic pain or illness are definitely a major driving force, there are often many other factors that contribute to keeping cortisol elevated.
Like how we think about things.
Absolutely. How we think about stress, our cognitive responses, are really critical. Negative thought patterns like constantly worrying, ruminating endlessly on problems, imagining the worst case scenario, catastrophizing, and feeling like we have no control over situations, these can significantly prolong and amplify the body's stress response, keeping that cortisol flowing.
So our mindset matters a lot. What else?
Sleep problems are another huge factor. Disruptions to sleep mess with that normal daily cortisol rhythm we talked about, often leading to higher overall levels.
Makes sense.
Certain medications, particularly steroid medications like prednisone, can directly increase cortisol levels. Underlying health conditions are often involved too, things like Cushing syndrome, which is defined by excess cortisol, but also obesity, clinical depression, alcoholism, and eating disorders like anorexia are frequently associated with imbalances in the HPA axis and altered cortisol patterns.
Lifestyle choices.
Lifestyle definitely plays a role. Drinking too much alcohol or excessive caffeine intake can disrupt the system. And then there are factors like our individual genetic makeup. Some people are just naturally more reactive to stress, and as we touched on earlier, difficult experiences in early life can kind of program the HPA axis to be more sensitive or dysregulated later on.
It sounds like a really complex web of interconnected factors keeping the system out of balance.
It truly is, and it's so important to realize that when we talk about HPA axis dysregulation in chronic stress, it's not just about having too much cortisol all the time. It's more fundamental than that.
Mhm.
It involves changes in the dynamics of the system, things like altered sensitivity of those cortisol receptors, failures in that crucial negative feedback loop, disruptions in the normal daily rhythm, and even structural changes in the glands involved. They all contribute to a state where the system just doesn't respond appropriately anymore. It might not activate correctly when needed, or, more commonly in chronic stress, it fails to deactivate properly when the stressor is gone.
So it loses its flexibility, its ability to adapt.
Exactly. It loses that fine-tuned regulation. And that loss of regulation is why the effects of chronic stress are so widespread and damaging. And just to reiterate, the HPA axis doesn't work in a vacuum. It has incredibly intricate connections with the autonomic nervous system, that's your fight or flight and rest and digest system, and the immune system. Problems in one area can easily trigger or worsen problems in the others, creating these nasty feedback loops or vicious cycles.
Okay, so we have a pretty good picture now of what chronic stress is physiologically and what causes that HPA axis dysregulation. But how does this actually show up in our day-to-day lives? What are the common signs and symptoms we should be paying attention to, maybe in ourselves or others?
Right, the manifestations. The ways chronic stress can show up are incredibly diverse, and that's honestly one of the reasons it can be so sneaky.
Sneaky how?
Well, as you mentioned earlier, people can become so accustomed to feeling stressed or feeling its effects that they don't even connect their physical aches or their low mood to the underlying stress anymore. It just becomes their normal.
The normalization thing again.
Exactly. But generally, these symptoms tend to fall into four main categories: physical, emotional, cognitive, meaning related to thinking, and behavioral.
Okay, let's take a closer look at those. What are some common physical signs that someone might be experiencing chronic stress?
Physically, people under chronic stress often report experiencing various aches and pains. Headaches are very common. Could be tension headaches, could be migraines, muscle pain and tension, especially in the neck, shoulders, and jaw.
Oh, teeth grinding?
Yeah, teeth grinding or bruxism often happens at night. Persistent tiredness, fatigue, just feeling drained and having low energy levels is a huge one. Sleep disturbances are also incredibly common. Maybe difficulty falling asleep, staying asleep, waking up frequently, or even feeling the need to sleep excessively but still not feeling rested.
Digestive issues too, right?
Oh, definitely. Digestive issues are a frequent complaint. Things like stomach upset, heartburn, acid reflux, changes in bowel habits, constipation or diarrhea, nausea, bloating, that nervous stomach feeling.
What else physically?
You might also notice changes in your sex drive, either a decrease, which is more common, or sometimes an increase. Because chronic stress can weaken the immune system over time, people might find they're getting sick more often, catching every cold that goes around, or maybe taking longer to recover from illnesses.
Makes sense.
Cardiovascular symptoms can show up too, like feeling your heart race or pound, palpitations, or having borderline or high blood pressure readings. And then there's a whole range of other potential physical signs. Dizziness, feeling lightheaded, cold or sweaty hands and feet, excessive sweating elsewhere, dry mouth, sometimes tremors or nervous tics, even skin problems like acne or eczema flaring up, and sometimes irregular menstrual cycles in women.
Wow, that's a pretty extensive list
Yeah.
just on the physical side. What about how chronic stress affects our mood and feelings? What are some common emotional signs?
Emotionally, chronic stress often manifests as persistent anxiety or nervousness, just a general feeling of unease, dread, or constant worry that's hard to shake.
Like free-floating anxiety.
Exactly. Some people might even experience full-blown panic attacks. Increased irritability is very common, feeling easily angered, frustrated, snapping at people, just having a short fuse, a general sense of being on edge all the time.
Hmm.
A low mood is another significant consequence. This could range from just feeling down or blue more often than not to feelings of sadness, hopelessness, or emptiness that might indicate developing depression.
Feeling overwhelmed.
Definitely. Feeling overwhelmed, like you just can't cope with your responsibilities or daily demands, a sense of losing control over things. Lack of motivation is common too, finding it hard to get going, losing interest in activities you used to enjoy.
That sounds like anhedonia.
Yes, that's the clinical term anhedonia. A general feeling of apathy, just not caring as much. Feelings of loneliness or social isolation can also arise, maybe feeling disconnected from others, even when you're around them.
Anything else emotionally?
Yeah. Things like low self-esteem, feeling bad about yourself, feelings of guilt or shame may be related to not coping well, persistent fear. And sometimes people report difficulty experiencing positive emotions at all, kind of an emotional numbing. So it really impacts the whole emotional landscape.
Yeah, it's clearly not just about feeling stressed in your head. It really does impact your whole emotional world. What about our thinking and mental processes? How does chronic stress mess with us cognitively?
Cognitively, chronic stress can really impair function. Difficulties with memory are common, especially short-term memory trouble remembering recent information, where you put your keys, that kind of thing.
Forgetting names.
Forgetting names, appointments, focusing and concentrating can become a real challenge. People might find their judgment is clouded, or they struggle to make decisions, even simple ones.
Indecisiveness.
Yes, exactly. Negative thinking patterns often become dominant. Pessimism, a tendency to focus only on the negative aspects of situations, constantly anticipating bad outcomes.
Racing thoughts.
Racing thoughts are very common, or just being constantly preoccupied with worries, unable to switch off your brain. Overall, there can be a noticeable decline in the ability to perform complex mental tasks or solve problems effectively. And in situations where past trauma is involved, you might see intrusive thoughts about the traumatic event or persistent feelings of guilt related to it.
Okay, physical, emotional, cognitive.
Mm.
What about the fourth category? How does chronic stress change our behavior? What might we actually do differently?
Behaviorally, chronic stress often leads to changes in eating habits. This can go either way. Some people overeat, often seeking comfort in food, particularly sugary or fatty foods.
Stress eating again.
Yep. While others might experience a loss of appetite and eat less, unfortunately, people under chronic stress may turn to or increase their use of unhealthy coping mechanisms,
Like what?
like increased use of alcohol, tobacco, or recreational or prescription drugs, trying to self-medicate or just numb the feelings.
Mhm.
Social withdrawal is another really common behavioral sign. Someone starts avoiding contact with friends, family, pulling back from social activities they used to enjoy.
Isolating themselves.
Exactly. You might also see a decrease in physical activity, just not having the energy or motivation to exercise.
Hmm.
Increased irritability leading to more arguments or even verbal aggression sometimes. Maybe some impulsive behavior, making rash decisions or engaging in risky activities they wouldn't normally consider.
Procrastination.
Oh yeah, procrastination, difficulty starting or completing tasks, trouble meeting responsibilities at work or home, more frequent crying spells perhaps, noticeable problems in personal relationships due to irritability or withdrawal, and in more severe cases, you might see a significant inability to function effectively in key life roles at work, as parent, etc.
It's quite sobering, actually, hearing it all laid out like that, just how far-reaching the effects of chronic stress can be across all these domains. What's the longer-term impact on our overall health, both physical and mental?
The long-term consequences are, frankly, significant and very well documented by research. Chronic stress dramatically increases the risk of developing or worsening a wide range of serious physical and mental health conditions.
Okay, like what specifically?
Well, cardiovascular diseases are a big one. High blood pressure, coronary artery disease, increased risk of heart attack and stroke.
Metabolic issues.
Metabolic disorders too, absolutely. Obesity, type 2 diabetes, metabolic syndrome, that cluster of conditions that increases heart disease and diabetes risk.
And mental health.
In terms of mental health, chronic stress is a major risk factor for developing clinical depression. Various anxiety disorders like generalized anxiety disorder and panic disorder, post-traumatic stress disorder or PTSD, especially if trauma is involved, and also substance use disorders, problems with alcohol or drugs. Tragically, it also significantly increases the risk of suicidal thoughts and behaviors.
That's a really serious list of potential outcomes.
It is, and it doesn't stop there. Furthermore, chronic stress can lead to immune system dysfunction over the long haul. This can make us more susceptible to infections, as we mentioned, but also might contribute to the development or worsening of autoimmune diseases, things like rheumatoid arthritis or lupus and other chronic inflammatory conditions.
What about the gut?
It can cause chronic gastrointestinal issues, persistent problems like IBS or inflammatory bowel conditions. Sexual and reproductive problems can become chronic. Skin conditions like eczema or psoriasis can be persistently worse. It's strongly linked to chronic pain conditions like fibromyalgia or chronic back pain. And there's even some emerging evidence, though the link is still being actively researched, suggesting a possible connection to an increased risk of certain types of cancer, potentially acting through stress-related behaviors like smoking or poor diet, or maybe through effects on inflammation and the immune system.
Okay. You mentioned earlier, though, that some of these symptoms, fatigue, irritability, sleep problems, can overlap with other health issues. Why is that overlap important to keep in mind?
It's really important because the symptoms of chronic stress can look almost identical to symptoms of other conditions. Things like clinical depression, generalized anxiety disorder, burnout, which we discussed, but also physical conditions like hypothyroidism, an underactive thyroid, or anemia, low iron levels.
All can cause fatigue and low mood.
Exactly. Symptoms like fatigue, sleep problems, feeling irritable, having difficulty concentrating, these are super common across several of these conditions. And this overlap makes it tricky, sometimes impossible, to figure out what's really going on based only on the symptoms.
So you can't just assume it's stress.
You really can't. It highlights why getting a thorough evaluation from a healthcare professional, a doctor, maybe a psychologist or psychiatrist is absolutely essential. Experiencing these symptoms doesn't automatically mean it's just chronic stress. It could point to a co-occurring condition that also needs treatment, like depression and chronic stress, or it might indicate a completely different underlying medical issue that requires a specific approach. So getting an accurate diagnosis really requires looking at the whole picture.
The whole picture meaning.
Meaning a detailed discussion of your symptoms, your life situation, your full medical history, maybe some blood tests or other investigations to rule out those other physical conditions. You need context.
Okay. So given how varied the symptoms are, how subtle they can sometimes be, and this overlap issue, how do doctors actually go about detecting and diagnosing chronic stress? It sounds like it could be a real challenge.
It definitely presents some unique challenges, you're right. As we've discussed, the experience of stress is inherently subjective, it's personal. What one person finds incredibly stressful, another might handle differently. Then there's that whole issue of normalization we keep coming back to, people getting so used to feeling stressed they don't even recognize it as a problem anymore.
Right.
And of course, the overlapping symptoms with other conditions complicate things. However, despite these challenges, a thorough clinical evaluation remains the cornerstone, the most important part of the diagnostic process.
What does that clinical evaluation typically involve? What should someone expect?
Well, a detailed interview is generally considered the most direct and reliable way to assess stress levels and their impact. A healthcare professional, like a GP or a therapist, will ask you really in-depth questions, like about your current symptoms. What are they? How severe? How long have you had them? Any significant life events you've gone through recently or even further back? What are the ongoing stressors in different areas of your life? Work, family, finances, health. They'll ask about your personal and family medical history, and importantly, your mental health history, too.
Coping strategies.
Yes. What strategies have you tried to cope with the stress, and how well have they worked? And crucially, how is all this impacting your day-to-day life? Is it interfering with your job, your relationships, your ability to enjoy things or get stuff done?
A physical exam, too.
A physical exam is also a key part of the evaluation. This helps the clinician look for any physical signs that might be related to stress, like high blood pressure, muscle tension. But maybe more importantly, it helps to rule out other medical conditions that could be causing or contributing to your symptoms.
Ruling things out.
Exactly. They'll also specifically assess how much these stress-related symptoms are interfering with your ability to function in different areas of your life. That functional impact is important. And sometimes, depending on the complexity of the situation, bringing in specialists from different fields, maybe a cardiologist if there are heart symptoms, or a gastroenterologist for gut issues, might be needed for a more comprehensive understanding, a multidisciplinary approach.
Okay, the interview and exam are central. Are there any specific questionnaires or tests that are commonly used to help with this assessment, like standardized tools?
Yes, absolutely. Standardized questionnaires can be very useful tools. They help to quantify, to measure someone's subjective experience of stress or related symptoms in a more structured way. One of the most widely used and researched is the Perceived Stress Scale, or PSS.
PSS.
There are a couple of main versions, one with 14 questions, the PSS 14, and a shorter one with 10 questions, the PSS 10. These scales ask you about how often you felt certain things over the past month.
What kind of things?
Things related to how unpredictable, uncontrollable, and overloaded you felt your life has been. These are really core aspects of the subjective stress experience.
How does it work?
You answer these questions using a rating scale like never, almost never, sometimes, fairly often, very often. Some of the questions are phrased positively, so they need to be scored in reverse. Then you add up the scores to get a total score.
And higher scores mean?
Generally, higher scores suggest higher levels of perceived stress. The PSS has been translated and validated in many different languages and populations, so it's quite robust.
Is there like a cutoff score for diagnosing chronic stress?
Not really a strict diagnostic cutoff. It's more of a measure of perceived stress level.
Yeah.
However, research suggests that higher scores, for instance, maybe above 20 or 25 on the PSS 14, can indicate a significant level of distress that likely warrants attention. But it's always, always important to interpret these scores in the context of the individual's overall situation and clinical picture. It's a tool, not a diagnosis in itself.
Okay, so the PSS is one helpful tool. Are there other types of questionnaires that might be used alongside it in this process?
Oh, yes, definitely. Depending on what symptoms are most prominent or what other conditions might be suspected, other questionnaires can be very helpful. They can assess specific symptoms, often linked to stress, or help differentiate between conditions.
For example?
For example, scales designed to measure anxiety levels, like the GAD-7, scales for assessing the severity of depression, such as the Hamilton Depression Rating Scale, HDRS, or the CESD, questionnaires specifically designed to measure burnout levels if work stress is the main issue. Or, if trauma exposure is relevant, scales like the PCPTSD-5 or the PCL-5 to screen for PTSD symptoms. There are even questionnaires that look at physical symptoms that might be psychosomatic, related to psychological stress, and others that explore the different types of coping strategies someone uses.
So a whole toolkit of questionnaires potentially. What about actual biological tests? Can we measure something concrete in the body like cortisol to help diagnose chronic stress?
That's a really interesting and rapidly evolving area of research. Biomarkers, these are measurable indicators in the body, like hormone levels or inflammatory markers, definitely have the potential to reflect the activity of the physiological systems involved in the stress response, like that HPA axis we talk so much about.
And cortisol is the main one people look at.
Cortisol is certainly the biomarker that's been studied the most extensively in relation to stress. And as we discussed briefly, it can be measured in different ways, and each method gives slightly different information.
Right, you mentioned blood, saliva.
Exactly. Blood tests can measure the total amount of cortisol circulating at a specific point in time. But the big limitation there is that levels fluctuate so much throughout the day because of our natural circadian rhythm, so a single blood draw might not tell you much. Saliva tests measure the amount of free cortisol, which is thought to be the biologically active form. The advantage here is that saliva samples are easy to collect, non-invasive, and you can take multiple samples throughout the day. This allows you to track that circadian rhythm pattern or see how cortisol levels change in response to a specific stress test performed in a lab setting.
What about urine?
Urine tests, typically collecting all urine over a 24-hour period, can give you an overall measure of how much total free cortisol was excreted by the body during that day. It gives a kind of integrated picture.
The hair. That sounded interesting.
Yeah, measuring cortisol in hair is a relatively newer technique, but it's gained a lot of traction. Because cortisol gets incorporated into growing hair, analyzing a small segment of hair, say the centimeter closest to the scalp, can provide a retrospective measure of average cortisol exposure over the preceding weeks or even months.
Wow, so that could potentially reflect chronic exposure better than a single point-in-time measure.
That's the idea, yes. It could be really helpful for looking at chronic stress over a longer time frame, smoothing out those daily fluctuations.
Okay, so cortisol can be measured in various ways.
Mhm.
Are there other biological markers beyond cortisol that researchers are investigating for chronic stress?
Yes, quite a few others. Researchers are looking at other hormones involved in the HPA axis itself, like ACTH and CRH, although measuring them reliably can be tricky. Hormones like DHEA and its sulfate form, DHEAS, are also of interest. They're sometimes seen as counter-regulatory to cortisol, and lower levels have been linked to burnout recovery, for instance.
Anything else?
There's interest in things like brain-derived neurotrophic factor, or BDNF, a molecule important for brain health, neuronal growth, and mood regulation levels might be lower in chronic stress or depression. Markers related to the other part of the stress response, the sympathetic nervous system, the accelerator, like catecholamines, adrenaline, noradrenaline, are sometimes measured, but they change very rapidly, making them less reliable for assessing chronic states. Heart rate variability, HRV, is another measure related to autonomic nervous system balance that's often studied.
What about inflammation markers?
Yes, markers of inflammation and immune function are a big area of focus, given the links between stress and immunity. Things like cytokines, IL-6, IL-1 beta, TNF-alpha, or C-reactive proteins, CRP, are often measured, though results can be inconsistent.
Right.
Metabolic markers, too, like blood glucose, HbA1c, a measure of long-term blood sugar control, triglycerides, cholesterol. These are relevant because chronic stress impacts metabolism and cardiovascular risk. And some researchers look at markers of oxidative stress, which is like cellular damage.
Okay, it sounds like there's a huge amount being studied in the research world. But what's the actual practical value of using these biomarkers in diagnosing chronic stress in a regular doctor's office right now? Can they really tell you if someone has it?
That's the absolutely crucial question, and the honest answer is right now, their routine use in clinical practice specifically for diagnosing chronic stress is still quite limited.
Why is that?
Well, several reasons. Firstly, there's just a lot of natural variation between individuals in how their bodies respond to stress, so what's high for one person might be normal for another. Secondly, many things besides psychological stress can influence these biomarker levels: diet, exercise, sleep, medications, underlying medical conditions, time of day. It's complicated to isolate the effect of stress.
No clear cutoffs.
Exactly. We generally don't have clear, universally agreed upon standardized ranges or cutoff points for most of these biomarkers that definitively say, okay, this level means you have clinically significant chronic stress. The methods for measuring and interpreting some of these markers can also be complex and aren't available everywhere. And frankly, research findings in this area are often inconsistent across different studies.
So they're not diagnostic on their own.
Definitely not. Cost and accessibility can also be barriers for some tests. So, importantly, no single biomarker, not even cortisol measured in hair, can diagnose chronic stress on its own. They always need to be considered within the full clinical context.
The context being.
The patient's detailed story from the interview, their self-reported symptoms, the results from questionnaires like the PSS, the physical exam findings. Biomarkers might provide supportive evidence in some cases or help track response to treatment and research, but they don't replace clinical judgment. So while the search for objective biological measures is really important and ongoing, the most reliable way to diagnose chronic stress currently still relies heavily on that careful integration of information from the clinical interview, what the person is actually reporting about their symptoms and experiences, potentially supported by questionnaires, and ruling out other conditions.
Okay, that makes sense. We've covered a lot about the physical side of the HPA axis, the symptoms, how it's diagnosed. Let's shift gears a bit and dig into some of the more psychological aspects. You mentioned earlier this really interesting idea of the normalization of stress. Can you expand on what that means psychologically?
Yes, the normalization of stress is a really important psychological phenomenon we see quite often with chronic stress. Essentially, it's when someone becomes so accustomed, so habituated to living with persistent stress day in and day out that they stop recognizing it as being unusual or problematic.
So feeling stressed just becomes normal life.
Exactly. They might start to think of their constant state of tension or their fatigue or their irritability as just who they are now, or maybe even rationalize it as a necessary part of being successful or productive or dedicated. Everyone's stressed, right?
Yeah, you hear that a lot.
You do. And this adaptation, while it might seem like it allows someone to keep functioning, to keep pushing through in the short term, is actually quite risky.
Why risky?
Because it can lead them to ignore or downplay the very real ongoing damage that the stress is causing to their physical and mental health. They might not connect their increasing aches and pains or their sleep problems or their low mood to the underlying stress. And because they see it as normal, it can significantly delay them from seeking the help or making the changes they might desperately need.
And you mentioned earlier that this psychological normalization might be connected somehow to our bodies actually getting used to stress on a physiological level,
That's,
something called habituation.
that's right. There's a physiological process called habituation of the HPA axis, which we touched on briefly. This refers to a gradual reduction in the hormonal response, less cortisol, less ACTH released when you're repeatedly exposed to the same type of stressor over and over again.
So the body kind of learns, okay, this happens a lot. Maybe it's not an emergency every single time.
Sort of, yes. It's generally thought to be a helpful adaptive mechanism, helping us conserve energy and resources when faced with predictable or non-threatening stimuli that we encounter frequently. However, the relationship between this physiological habituation and psychological normalization is complex, and they aren't the same thing.
How are they different?
Well, it's possible that the reduced hormonal jolt contributes to the subjective feeling that the stressor is less impactful, which could feed into normalization. But you can have physiological habituation without necessarily psychologically normalizing the stress. You might still recognize it's bad for you, even if your cortisol spike isn't as high. And vice versa. You could normalize stress psychologically, even if your body is still having a strong physiological reaction. And here's another interesting twist. Research suggests that a lack of appropriate physiological habituation, continuing to have a huge stress response every single time you face the same moderate stressor, is actually linked to certain mental health conditions, like depression and PTSD.
Hmm.
So some level of physiological adaptation seems normal and maybe even healthy. It's the psychological normalization, the thinking, this is fine, when it's actually harmful, that's particularly maladaptive because it prevents action.
Okay, that's a subtle but important distinction. You also brought up another intriguing idea earlier, something about stress seeking. Could you explain what that might involve? It sounds a bit counterintuitive.
It does sound counterintuitive, right? Why would anyone seek stress? The idea here isn't really about people being addicted to cortisol itself, especially given all the negative long-term effects we just discussed. That doesn't make much sense.
So what's the theory then?
Well, some researchers have explored the possibility that individuals who frequently experience negative states like low mood, boredom, or anhedonia, that lack of pleasure, which, remember, can be linked to chronic stress or underlying depression, might, perhaps subconsciously, seek out situations that are acutely activating or stimulating.
Why would they do that?
Because these situations, even if they are stressful in some ways, can trigger the release of other neurochemicals, think adrenaline, dopamine, which can create a temporary feeling of excitement, intensity, or energy, a rush.
So it's like you're trying to jumpstart their system.
Almost, yeah. It could be seen as a kind of dysfunctional way of trying to regulate their emotions, an attempt to temporarily counteract those underlying flat or negative feelings. It's important, though, to distinguish this from healthy engagement in challenging activities, or just being someone with a high sensation-seeking personality who enjoys new experiences without it causing harm. This type of stress-seeking becomes problematic when it's compulsive, leads to negative consequences, or becomes the primary way someone tries to cope with feeling bad. It might be more like a maladaptive behavioral pattern than a true addiction.
It's a really interesting perspective, thinking about it as seeking activation rather than stress itself. What about the letdown effect you mentioned? That also sounds surprising. You'd think you'd finally feel better once a really stressful period ends.
You would think so. But the letdown effect is this phenomenon where people actually experience an increase in physical or psychological symptoms, like suddenly getting sick with a cold, feeling more anxious or irritable than ever, or having a significant dip in their mood after a period of intense or prolonged stress has finally come to an end.
When does this happen?
Classic examples were people getting sick the minute they go on vacation after a crazy busy period at work, students getting ill right after final exams are over, or sometimes people experiencing low mood or health problems after retiring or finishing a massive all-consuming project.
Why? What's going on there?
There are several potential explanations, likely a combination of physiological and psychological factors. On the physiological side, your immune system, which might have been suppressed or altered during the high-stress period, could experience a temporary dip or maybe a rebound effect as your body tries to readjust, leaving you more vulnerable to infections.
Okay.
Your HPA axis and sympathetic nervous system also need time to recalibrate back to their normal baseline levels after being in overdrive. During that transition period, there can be temporary imbalances or lingering effects. Maybe the amygdala, the brain's threat detector, stays a bit hyperactive for a while. Some researchers even draw parallels to what's seen in post-acute withdrawal syndrome after stopping addictive substances. The idea that your brain's neurotransmitter systems need time to rebalance after being chronically exposed to the drug of stress hormones.
And psychologically.
Psychologically, a few things could be happening. If you strongly identified with the stressful role or situation, its ending might bring a sense of loss of identity or purpose. Underlying worries or unresolved issues that were being pushed aside or overshadowed by the main stressor might suddenly resurface now that you have the mental space for them. Or, quite simply, you might just become more aware of the sheer accumulated exhaustion and the toll the stress has taken once the pressure is finally off, and you actually have the time and quiet to notice how you really feel. The adrenaline isn't masking it anymore.
So feeling worse after the stress is finally over is actually a real recognized thing. How do all these psychological aspects we've just talked about, the normalization, the habituation, maybe stress seeking, this letdown effect,
Yeah.
how do they all connect or interact?
They seem to interact in a really significant way, often creating tricky cycles. Physiological habituation and psychological normalization can, as we said, allow you to keep functioning, sometimes for years, under considerable stress. But the downside is huge. They mask the ongoing harm that's being done and make you less likely to recognize the problem or seek help.
Right.
Then the anticipation or even the actual experience of feeling worse during that letdown period, if you do try to reduce the stress, like taking a vacation or changing jobs, can create an additional psychological barrier. It can make people afraid to leave stressful situations, thinking, well, at least I know how to handle this stress. Maybe the alternative will be even worse.
So you can get kind of trapped.
Exactly, caught in a cycle. And then looping back to stress, seeking what might appear as someone actively seeking out stressful situations on the surface, could, in some cases, actually be understood as an attempt to temporarily counteract the negative feelings, the flatness or anxiety that arise either from the chronic stress itself or from its cessation during that letdown phase. It's not necessarily about craving the chronic stress, but more about seeking those short bursts of activation to feel something, anything different from that underlying negative state.
This really highlights just how crucial it is to become more aware of our own internal experiences, our own stress levels, especially if normalization is so common. How can we actually cultivate that kind of self-awareness? It seems like that's got to be the critical first step.
It absolutely is. Overcoming that tendency to normalize stress really begins with intentionally, consciously developing self-awareness. It's an active process.
What does that involve, practically?
It involves actively learning to recognize your own individual stress signals because they can be different for everyone. This means, firstly, trying to identify your personal triggers. What are the specific situations, interactions, maybe even internal thoughts or demands that consistently seem to kick off a stress response for you?
Paying attention to patterns.
Yes. It also involves really tuning in and listening to what's happening in your body and with your emotions. Noticing those early, maybe subtle physical signs of tension like shallow breathing, tight shoulders, a clenched jaw, or noticing those slight shifts in your mood, feeling a bit more irritable, a bit more withdrawn, a bit anxious before they escalate.
Observing behavior, too.
Definitely. Observing your own patterns of behavior can provide really important clues. Are there changes in your sleep patterns? Your eating habits, eating more, eating less, craving certain foods? How active have you been? Are you withdrawing socially more than usual? Are you reaching for that extra glass of wine or smoking more? These behavioral shifts are often red flags.
Okay, so becoming more observant.
Mm.
What are some specific techniques we can use to actually do this, to check in with ourselves and become more aware?
There are several practical techniques. Keeping a stress diary, even for just a week or two, can be incredibly insightful.
What do you track in a stress diary?
You'd regularly jot down any events you found stressful, what thoughts and feelings came up in response to them, any physical reactions you noticed in your body, and maybe how you behaved afterwards. Did you snap at someone? Did you have trouble concentrating? Doing this helps you identify those personal patterns and triggers that you might not have been consciously aware of before.
Mindfulness seems relevant here, too.
Hugely relevant. Practices like mindfulness, which is essentially about intentionally paying attention to the present moment, without judgment, are powerful techniques for increasing self-awareness. By deliberately paying attention to your breath or the physical sensations in your body, or just observing the flow of your thoughts and feelings without getting carried away by them, you become much more attuned to recognizing those early signs of tension, worry, or agitation as they arise.
Are there specific mindfulness exercises?
Yes, many. Things like simple breath-focused meditation, even for just 5–10 minutes a day, body scan meditations, where you systematically bring awareness to different parts of your body, noticing any sensations, or even just trying to bring mindful attention to everyday activities like washing dishes or walking, noticing the sensory details. These practices train your awareness muscle.
What about just simple reflection?
Absolutely. Taking regular moments throughout the day for simple self-observation and reflection is key. Just pausing and asking yourself, how am I genuinely feeling right now, physically and emotionally? Noticing any physical tension you might be holding unconsciously. Becoming aware of recurring thoughts or worries. Periodically reviewing self-assessment questionnaires like the PSS we discussed can also provide a more structured way to gauge your stress levels over time.
Asking others.
And don't underestimate the value of seeking honest feedback from people you trust, maybe a close friend, a partner, a family member. Sometimes others notice changes in our mood or behavior, signs of stress, that we've become blind to ourselves. Asking them gently, "Have you noticed me seeming more stressed lately?" can sometimes be really eye-opening.
So it's really about making a conscious, deliberate effort to pay attention to ourselves, our bodies, our minds, our behaviors in a curious and non-judgmental way.
Exactly. Developing this kind of self-awareness isn't passive. It's an active, ongoing process that requires deliberate practice. It's about peeling back the layers of normalization to uncover those stress signals that have become so familiar that we barely even register them anymore. That awareness is the foundation for making changes.
Okay, so we're starting to recognize the signs. We're building that self-awareness. Now, the crucial part. What are some evidence-based strategies that we can actually use to manage and reduce chronic stress? What does the research show really works?
Right, the what to do about it part. The evidence strongly suggests that an integrated approach, combining different types of strategies, tends to be the most effective for managing chronic stress long term. It's usually not just one magic bullet.
Okay, where should we start? Lifestyle changes.
Lifestyle modifications are absolutely fundamental, a real cornerstone. Regular physical exercise is probably one of the most powerful stress busters we have.
How does exercise help?
It helps in so many ways. It helps to lower levels of stress hormones like cortisol over time. It releases endorphins, which are natural mood boosters and pain relievers. It improves the quality of your sleep. It directly benefits your cardiovascular health and metabolism, counteracting some of stress's negative physical effects. And it can even improve cognitive function and focus.
What kind of exercise and how much?
General recommendations usually suggest aiming for at least 150 minutes of moderate intensity aerobic exercise like brisk walking, cycling, swimming, or 75 minutes of vigorous intensity aerobic exercise like running or HIIT spread throughout the week, plus including muscle strengthening activities like lifting weights or using resistance bands at least 2 days a week. But honestly, the most important thing is to start gradually, especially if you're not active now, and crucially, to choose activities that you actually enjoy. That makes it sustainable.
Makes sense. What about diet?
Eating a balanced, nutritious diet is also crucial. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats helps to stabilize your blood sugar levels, which can affect mood and energy. It supports optimal brain function and immune function. It provides you with more consistent energy throughout the day. Generally, it's best to limit highly processed foods, sugary drinks, and excessive amounts of caffeine, as these can sometimes exacerbate stress symptoms or lead to energy crashes. Eating regular meals can also help stabilize blood sugar and mood.
And sleep. We keep coming back to sleep.
Because it's so critical, prioritizing good sleep hygiene is absolutely essential for physical and mental recovery, for regulating emotions effectively, and for managing stress. Most adults need around 7 to 9 hours of quality sleep per night. Trying to maintain a regular sleep schedule, going to bed and waking up around the same time, even on weekends, really helps regulate your body's internal clock. Optimizing your sleep environment, making sure it's dark, quiet, cool, and limiting screen time and stimulants like caffeine or alcohol close to bedtime are also key parts of good sleep hygiene.
Social support.
Don't underestimate the power of social support. Having strong, positive connections with friends, family, or community groups can act as a powerful buffer against the negative effects of stress. Talking about your problems with someone you trust can provide emotional comfort, offer different perspectives, and simply make you feel less alone. Actively nurturing those relationships, spending quality time with loved ones, and maybe even considering joining a support group if you're dealing with a specific stressor like caregiving or a health condition can be incredibly helpful.
Avoiding bad habits.
And yes, part of lifestyle modification is also identifying and consciously trying to reduce any unhealthy coping mechanisms you might be relying on. Things like excessive alcohol use, smoking, or other tobacco use, relying on drugs, or even using food excessively as a primary coping tool. Trying to shift away from passive or avoidant ways of dealing with problems towards more active, problem-focused coping is also important.
Okay, those all sound like really important foundational healthy habits, but it's helpful to explicitly connect them to stress management. What about specific relaxation techniques or mindfulness practices? Are those effective?
Yes, relaxation and mindfulness techniques are incredibly valuable tools. Their main benefit is helping to reduce the body's physiological activation, calming down that fight or flight response, and promoting a sense of mental and physical calm.
What are some examples?
There are many. Simple techniques like deep, diaphragmatic breathing, belly breathing, can have an almost immediate calming effect, and you can do it anywhere. Progressive muscle relaxation, or PMR, involves systematically tensing and then releasing different muscle groups throughout your body. This helps you become more aware of where you're holding physical tension and learn to let it go.
Visualization.
Visualization or guided imagery uses your imagination to create peaceful, relaxing mental scenes or experiences, which can help shift your focus away from worries. Various forms of meditation are highly effective mindfulness meditation, which we discussed, focusing on present moment awareness of breath or sensations. Mantra meditation, even walking meditation or prayer can function as meditative practices for some.
What about structured programs?
Mindfulness-based stress reduction, or MBSR, is a well-known structured 8-week program developed by John Kabat-Zinn. It combines mindfulness meditation, body awareness exercises, and gentle yoga, and has a very strong body of research supporting its effectiveness in reducing stress, anxiety, depression, and improving overall well-being. Practices like yoga and Tai Chi are also excellent, as they combine physical postures and movement with breathing techniques and a meditative focus. Even things like getting a massage or using aromatherapy with calming scents can contribute to relaxation.
What's key for these techniques?
The absolute key with all of these relaxation and mindfulness techniques is regular practice. Just doing them once in a while might feel good temporarily, but practicing them consistently, ideally daily, is what really builds resilience and helps rewire your stress response over time.
Okay. And what about more formal psychological interventions? When might something like therapy be recommended or particularly helpful for managing chronic stress?
Psychological therapies can be extremely helpful, especially when stress is severe, persistent, linked to specific issues like trauma or anxiety, or when lifestyle changes and relaxation techniques alone aren't enough. Cognitive behavioral therapy, or CBT, is one of the most widely researched and effective therapies for stress-related problems.
How does CBT work for stress?
CBT focuses on helping you identify and then modify the unhelpful thought patterns, underlying beliefs, and maladaptive behaviors that contribute to your stress and maintain it.
What kind of techniques does it use?
Techniques used in CBT can include things like cognitive restructuring learning to recognize, challenge, and reframe those negative, stress-inducing thoughts. Exposure therapy might be used if specific situations trigger intense anxiety. It also involves learning and practicing practical coping skills, problem-solving strategies, and incorporating relaxation techniques. CBT has been shown repeatedly to be very effective in reducing stress, anxiety, and depression symptoms, improving sleep, and enhancing overall quality of life across a wide range of conditions and stressors. Its effects are often comparable to medication for anxiety and depression.
Are there other types of therapy besides CBT?
Yes, absolutely. Other evidence-based therapies can also be very helpful. Acceptance and commitment therapy, or ACT, focuses on increasing psychological flexibility, learning to accept difficult thoughts and feelings without struggling against them, clarifying your personal values, and committing to actions aligned with those values, even in the presence of stress. MBSR, which we mentioned, is often delivered in a group therapy format. And if the chronic stress stems from past trauma, specific trauma-focused therapies like cognitive processing therapy, CPT, eye movement desensitization and reprocessing, EMDR, or prolonged exposure, PE therapy would be recommended. Even things like clinical hypnosis can be used as an adjunct for stress management.
It sounds like learning to manage our time better and setting healthier boundaries could also make a pretty significant difference, especially feeling overwhelmed is a big part of the stress.
Absolutely critical. For many people, chronic stress is directly linked to feeling overwhelmed by too many demands, poor organization, or an inability to protect their time and energy. So, learning effective time management skills is key. This includes things like setting clear priorities, planning tasks realistically, breaking large tasks into smaller steps, and setting achievable daily or weekly goals. This can really reduce that feeling of being constantly snowed under.
Saying no.
Learning how to politely but firmly say no to additional commitments or requests when you're already feeling stretched thin is a crucial skill for boundary setting. So is learning to delegate tasks when possible, both at work and at home, and asking for help when you need it. That's not a sign of weakness.
Work-life balance.
Exactly. Establishing clear boundaries between your work life and your personal life is also essential, especially these days with remote work blurring the lines. This means protecting your non-work time for rest, relationships, and activities you enjoy. Turning off work notifications, having dedicated work hours, creating physical separation if possible. These boundaries are vital for recovery and preventing burnout.
Okay. Are there any other, perhaps less formal or maybe even overlooked strategies that people find helpful for dealing with chronic stress day to day?
Yes, definitely. Sometimes the simpler things get overlooked. For instance, consciously cultivating a sense of humor, being able to laugh at situations or at yourself, can be a surprisingly effective stress reliever and perspective shifter.
Hobbies.
Making sure you actually schedule and set aside time for hobbies and activities that you genuinely enjoy, things that engage you and bring you pleasure, is vital for maintaining balance and recharging your batteries. It's not frivolous, it's necessary.
Mindset shifts.
Learning to practice acceptance for the things that are genuinely outside of your control, rather than constantly fighting against them, can free up a lot of mental energy. Consciously shifting your perspective to practice gratitude, focusing on the positive aspects of your life, even small ones, can also make a significant difference in how you perceive and experience stress over time.
And knowing when to get help.
And finally, perhaps most importantly, recognizing when your stress levels feel overwhelming, when they're significantly impacting your health, relationships, or ability to function, and having the courage to seek professional help. Talking to your doctor, finding a qualified psychologist or therapist, reaching out for support is truly a sign of strength and self-care, not weakness.
It really sounds like combining these strategies is the way to go.
It really is. It's worth emphasizing again that these strategies often work best synergistically when you use a combination of them tailored to your own needs. For example, starting regular exercise might boost your mood and energy, which then makes it easier to engage consistently in mindfulness practices or tackle difficult conversations. A multifaceted approach that addresses your physical, emotional, cognitive, and behavioral well-being is generally the most effective path for sustainable, long-term stress management.
This has been incredibly helpful and really insightful. Thank you. To try and bring everything together now, what are the absolute key things you'd want our listener to take away from this whole deep dive into chronic stress?
I think the main points are these. Chronic stress is a very real state of prolonged physiological and psychological activation that has significant widespread effects on both your body and your mind. It's not just in your head. But the good news is it is definitely something that can be managed and reduced.
And the first step.
The most important first step, I believe, is developing that self-awareness, really learning to recognize those often subtle signs and symptoms of stress in yourself, especially the ones that might have become normalized for you over time. You can't change what you're not aware of.
Seeking help.
It's also crucial to remember that seeking help when you need it, whether from loved ones, healthcare professionals, or therapists, is absolutely a sign of strength and proactive self-care, not failure.
And finding what works for you.
Exactly. There isn't one single magic solution that works for everyone. Taking a proactive, personalized, and comprehensive approach, combining lifestyle changes, relaxation techniques, maybe therapy if needed, boundary setting is really key to effectively managing chronic stress and rebuilding your resilience.
Perfect. And finally, as always, a thought to leave you all with, as you reflect on our conversation today, maybe take a moment to consider, what are some of those potentially normalized stress signals that you might be experiencing in your own life right now? And perhaps could you identify just one small evidence-based strategy that we discussed today that you could realistically explore further? Or maybe even try to incorporate into your own life starting this week to begin breaking that cycle. We really encourage you to delve deeper into the sources we've drawn from or to explore other related information to continue your own learning journey. Thank you so much for joining us for this deep dive.